A fresh industrial action looms in Nigerian universities as the lecturers threaten to resume the strike action they suspended in December 2020. They are not happy that the government has failed to honor many of the agreements it signed with their union, the Academic Staff Union of Universities, ASU. This is coming even as the National Association of Resident Doctors remains on strike. The doctors who work in public health institutions called the strike on August 2 over unpaid salaries and allowances. Joining us right now is the Minister of Labour and Employment, Dr. Chris Ngige. Honorable Minister, thank you for joining us on This Day Live, the Sunday Talk Show.
Thank you, Ruben. Thank you. Excellency Ruben. Thank you.
Thank you for joining me. Well, very quickly, why is it that it's so difficult for the federal government to keep to agreements, as is being alleged by the National Association of Resident Doctors, who have been on strike for more than 21 days now, in fact, for about a month, and also the Academic Staff Union of Universities, who are saying that the agreement reached in December 2020 has been breached by the federal government. When university teachers of the Ibadan zone met recently, they said that you lied to the nation when you said that the federal government had met all the issues in the memorandum of action that was signed in December 2020, and that about 9 months later, what they can establish is that the federal government has met only 2 of the agreements, which is one, the setting up of a visitation panels to the universities, and then the payment of withheld salaries. Do you stand guilty as charged?
Okay, very good. Which one do you want me to deal with first?
No, one after the other.
You want me to deal with the Academic Staff Union of Universities, one after the other?
Yes.
Well, let me take the one of the Academic Staff Union of Universities, because that is the issue that I think is not too serious, even though the chairman of the Ibadan zone is making it look like he's making a mountain out of a molehill. And first of all, I would like to tell them to be truthful and to be very careful when they are talking to the nation. Unionism doesn't mean you come and you paint the government of the day black. You tar the government because you want to make a point. That's one. 2, they should also realize that I'm not their employer. I'm only a conciliator. I'm only an arbitrator. When negotiations with their employer fails, the employer is the Federal Ministry of Education, and by extension, National Universities Commission. Now, when there is a discussion over there in those 2 points and the negotiation fails and there's a threat to strike, that is when I come in proactively to stem the threat of strike. Sometimes they do not even go to the labor laws to give the required mandatory notice of strike. They will tell you that they're resuming a suspended strike. There is nothing like a suspended strike. There's nothing also like a warning strike. A strike is a strike. There have been court pronouncements on this, but they choose to ignore it. We will also get them to have all those court pronouncements very soon again. Now, coming to their allegations, I'm very happy you use the word allegation. What are the issues we conciliated on in December? About 7 prominent issues. One is the end academic allowances. We earlier on agreed that it will be 30 billion for all the workers in the health institution, including ASU, NASU, SANU, and the rest. Midway, when they came back to the meeting, they said their members said they would take the 30 billion alone. So we started having to contend to look for more money for SANU, and the research associations. The money is not packed anywhere. We're in a state of dwindling resources. We don't produce our OPEC quota of 2.2 million barrels. We are not selling oil at $120 a barrel or $100 a barrel when they got all those negotiations in 2013. Not even with this government. It should be clear. So when they are talking, they should be talking as people who are imparting knowledge to others. Some of them are economic teachers, finance teachers. So they should know that the thing is not the same. Now, you now took the 30 billion. We now said, let us not go into another round of crisis. Let us make it up to 40 so that we can give the other group 10 billion. We did that and released the money for them in January. They are not counting it. They only told you it's visitation panel and shortfall of salaries. Visitation panel was there. We've done visitation panel. They have gone and done their work. The reports have been turned back. Shortfall of salaries had also been done by Budget Office of the Federation 3. Mushrooming of universities by state governments. The National University Commission have sent a bill to National Assembly. We all agreed that they and their employers will work together to go to National Assembly and push the bill. So how is government liable now that they have done, the executive portion have done their own? Some of their members in some universities in, I think, Akure or wherever, and the lorry, they said they were punished, they weren't paid salary, they have been paid. Now, we have the 6th point, which is revitalization of universities system. Government had agreed with them to pay 30 billion so that the universities will be revitalized. Like I told you, this money is not packed anywhere. Government has to look for money because the Accountant General and the Minister of Finance have to look to where they can shuffle this money here and put there for the next month. That's what happened. So there was an account. There's an account for this money in the CBN. So the 30 billion was there. The Accountant General Office and the Finance Ministry tendered evidence, and we gave them the evidence. They went to CBN and they saw the money. So at the last meeting I had with them, which was about, I think, a month ago or so, we agreed that they are going to work with their parent ministry, NUC, Accountant General's Office, and CBN, and get this money transferred to the NIS account. This assessment account is the one being used for revitalization. And they all agreed. Today, they say Ngige is not saying the truth, he's lying. I am not their employer. I'm a conciliator. So I've told their president that if they keep on shouting my name, I will send them to industrial court with their employers. I don't have time for them anymore.
Dr. Ngige, well, just before...
No. I don't have time anymore.
Well, before I come to this industrial court...
People in my ministry, some senior officers are falling ill over this deaf and dumb negotiation. No.
Well,
I don't want that.
What ASU is saying is that the last meeting that you referred to in August, this was over the 2019 memorandum of action that was signed. 2019. There was 2019, then there was the December 22, 2021, and that you had promised that, look, this...
Yes, everything in 2019 was carried over into 2020.
Okay, they now said that...
Except those we have dealt with in that early 2020.
Okay, but they said you had promised that there will be a report that will be sent to the government by August 21, and there will be immediate action. But this is now the second week of September, and they have not had anything.
I didn't promise them anything. I'm not their employer. Maybe they're afraid of the Minister of Education.
Okay.
And going to the man they think they can pounce on and beat. Because of my small size, but they will be disappointed.
Well, one other issue is about the integrity of...
The committee, let me explain that to you. Let me explain that to you, Robin. The Ministry of Education has set up a panel, a committee, for renegotiation of the 2009 agreement. That is the seventh issue. And that committee has worked and is domiciled in the Ministry of Education. I have two observers there. Salaries, Incomes and Working Committee have observers there. We're not even advisors, because that concerns them and their employers. So what are they supposed to do? They're supposed to look at their condition of service. Look at their wage structure, which is onerous. Look at some of the allowances they are getting, which they want enhanced. Look at the new allowances they want introduced. So Ministry of Education, suo motu, cannot grant them that. When the Ministry of Education arrives at anything, the committee that has presented it will be functus officio. They will now send it to the higher level body. In this case now, we have a presidential committee on salaries and wages, chaired by the Minister of Finance, Budget and National Planning. I co-chair it, assisting her. So when he comes there, they will advise government vis-a-vis the finances that are available. Because Minister of Education doesn't have the finance records. So this is what they are saying government has refused to sign. No, government doesn't work that way. They have to finish with the education. They have not finished with the education. What? Because from information I got, education pointed out to them that a lot of the things they have in that committee report need to be revisited.
Okay. There is this other issue also about the integrity of the University Transparency and Accountability Solution, UTAS, which ASU proposed as a payment platform. And in 2020, one of the agreements was that government was going to conduct an integrity test and take a decision. And this is UTAS versus IPs. Now, part of their claims is that government is conducting this integrity test as if it's an endless exercise. Where are we with the integrity test on the UTAS?
Again, I will give you information because I'm conciliator, and everybody will give me his or her own paper. The government group will say, I will ask them, answer this query from ASU. They will present their papers. I will ask ASU, if you have new allegations on this, bring it so government people will look at it. And this is exactly where we are, and it has been done. So at our last meeting, we advised NIDA, which is the government agency in charge of all internet facilities of government, broadband and the rest of them all, to brief us on where they were. And they briefed us and said that they had invited ASU and National Universities Commission to come for what is called users test, which is the last test before they will now do the hardware analysis and compartmentalization and test. The hardware is supposed to be housed in National Universities Commission. Let me tell you something. This government is a government that have brought out executive orders, 5 and the rest of them, for local content to be used. We don't want to be spending the dollars we don't have. So they made a case and said that IPs is foreign-based. And so what we told them, bring your UTAS, let us see how we can synchronize it with IPs and ease off the IPs component that is foreign-based. But they are still suspicious of government up till now. 2 weeks ago, they have now brought their users, the bursars from the universities and finance officers from universities to come for training and for demonstration with NIDA on the UTAS. So I don't understand. They will go to Ibadan and start making press conferences to show their members that they're working.
Well, Dr. Ngige,
and that the election as union president is not of vain.
Well, I can assure you that ASU will also get an opportunity to come and respond to some of the issues you have raised. Because some of them are already bombarding my phone with comments saying that is Dr. Ngige now playing the victim when he should realize that if ASU goes on strike for another 9 months, the people who bear the brunt will be parents and their wards who may sit at home for another 1 year.
I have my children in Nigerian universities. When I said it, they said it's a lie. They said maybe the adopted children, maybe this. One of them graduated in Unilag on Friday. She lost one session because of the strike of last year. At the end of the day, they came to the table to negotiate. So why are you striking when things are being discussed?
Okay, I get your point, Dr. Ngige, but how about resident doctors? They say you and the Minister of Health are the problem. And they've even called on the president to sack both of you, who are doctors, but who seem not to be listening to them. You're on record as having said that resident doctors are playing God. And they say, well, you should be fired by the president, along with the Minister of Health, because you are their problem, they say.
They are talking from point of lack of knowledge. They don't know the issues that are involved in an employer-employee relationship. That's why they are talking like that. They are my junior colleagues, my nephews are among them. But my nephews are not going on strike. I told them, don't go on strike. In fact, my first child is a house officer. They railroaded them to go on strike with them, and we told them it's wrong. You can't. You have only provisional license. You're not full doctors. That's what is annoying them, because we're saying what is right to them. NARD, you cannot make strike an instrument of talking or negotiating with your principal. I'm not your employer. The employer is Minister of Health. But you people are lucky. I'm also a medical doctor. Not only am I a medical doctor, I was on the training desk of Department of Medical Services and Training for 5 years in Lagos. So I don't know what you will tell me again. I'm also I studied health system management and hospital administration. So what are you telling me again? We advise them, there is nothing we cannot discuss. So they listed 12 points. Four of the points had to do with state governments. 8 of them had to do with the federal government. What are the points against the federal government? They said that there are some resident doctors that are not being paid. They had worked for 3 to 4 months. When they said that, I was alarmed. Because I know that this government, like the president had consistently said, that he was a wage earner, and so we should not owe anybody his salaries and wages. So I told them, provide me the evidence. They brought the evidence. We passed it on to Federal Ministry of Health, their employers. Why are these doctors not paid? And they are University of Ibadan, Calabar, Port Harcourt, is it Bida Federal Medical Center, and one or two other places. The investigation showed that those doctors were not on IPs, number one. Why were they not on IPs? They were recruited by the various chief medical directors, CMDs, of those hospitals, in anticipation that they will be paid from the GIFMIS platform. Unfortunately, after employing them, the GIFMIS platform was abrogated by government in terms of personnel. Every personnel payment should go on IPs. What then happened? These chief medical directors were caught in between the devil and the deep blue sea. So they now incited these resident doctors. These resident doctors made it a point of strike, forcing Ministry of Health and Ministry of Finance that you must pay people who were illegally recruited. Before you go on government IPs platform now, your ministry must show evidence of a waiver or approval for the recruitment to be done by the parastatal. The head of service of the federation will give his approval and issue a waiver certificate. Budget office of the federation, BOF, will issue you manpower finance compliance certificate. Federal Character Commission finally will give you a federal character compliance certificate to show that the total enrollment or total recruitment done conforms with federal character. These people don't have it. The institutions don't have it. Okay, they went on strike. We now sat and said, okay, let us give clemency to these doctors that were recruited. Other health services people were recruited too. 205 doctors in UCH, 100 and something in Calabar, and another 100 and something in Port Harcourt. Port Harcourt is even better because the man has a waiver from Office of Head of Service for 2020, but he's now using it in 2021. So his own case is even different. We asked that he should be forgiven. The 2 others, the head of service insisted they must get a reprimand before she will give a waiver. And that is the right thing to do. So after her waiver, we now send the names to Budget Office of the Federation. And it's now being worked upon to regularize them and put them on IP's platform so that they can get the money for the 3 months or 4 months they have worked and get current pay. Yet is a sub-point for NARD to go on strike, well, to legitimate illegality.
Well, the NARD is saying...
Number 2 point is Medical Residency Training Fund. They again said it was not in 2021 budget. We went and looked. The Budget Office of the Federation captured it and put it in the supplementary budget. and he went to Mr. President, who signed it. Before Mr. President could sign it, they have now declared their strike. Just about the same time Mr. President was leaving overseas. Maybe to blackmail or embarrass Mr. President. I called them. I said, no, come. Look at the money. The money is here. It's here. You don't need to go on strike on this. So please, call off the strike. This thing will process. What you need to go and do is to go back to your center and working with the Postgraduate Medical College and Ministry of Health, emanate the list of beneficiaries. They agree with me. Only for them to use it and go on strike. 2 days after, or a week after. The 2020 payment of 4.2 billion was enmeshed in a lot of controversy because some people they submitted in the list were not resident doctors. They were principal medical officers, 1 and 2, senior medical officers, 1 and 2, and some people who have existed the residency training program. So about 588 names. So these are the issues, but I'm telling you now that of their 12-point issues, the 8 that has to do with federal government, some of them have been taken care of long time ago. They're just recycling and saying them so that it will look like somebody is victimizing them or somebody is... And they don't also know, many of these unions don't also know the difference between salaries and emoluments and allowances. When your salary is your monthly pay or weekly pay, depending on what you and the employer agrees on. Allowances are allowances you are paid because of the professional work you are doing, because of your profession. It could also be for hazard. It could also be for call duty for medical people. It could also be for shift duty for nurses. So when they come and they are owed or there's a mistake in payment of the allowances, they say we owe salaries. No, it's not the same. Emolument is different. It's the salaries and those allowances that becomes the emolument.
Well,
so these things are to be cleared because they will come and say government is owing us 8 months salaries, 4 months salaries, 3 months. No. Well, no, this government is not owing anybody that have been legitimately employed. Well, I can tell you that. Even the president reiterated that last Friday.
Which is my point. The president of the National Association of Resident Doctors says that, look, part of the problem is that they don't trust you, they don't trust the Minister of Health, and that they will rather negotiate directly with the president. And that you refer to some doctors as...
They say they will negotiate with the president.
Who are they?
Who are they? Were they trained in heaven to be doctors? Am I not a doctor?
Well,
did they get half of the training I got?
They claim you refer to some doctors as illegal doctors. Do we have illegal doctors in Nigeria? Are persons on residency training program illegal doctors?
I said illegally recruited. Illegally recruited. They were illegally recruited. The same thing happened with the housemanship program. Federal Executive Council gave the powers to recruit house officers effective from January to the Medical and Dental Council of Nigeria. Who is the person giving them provisional license? Now, between October and that January, and even onto that January, about six teaching hospitals went and recruited house officers in breach of the government regulation. Well, is it fair?
Well, Dr. Ngige,
they didn't want to give out their powers to the MDCN.
Well, Dr. Ngige, I'm sure the resident...
What we are doing in MDCN... No. What government is doing, listen carefully, what government is doing is to make sure that the son of the rich, the son of the poor, go to that portal and is recruited.
Well, I'm sure...
Otherwise, we have cases of people paying to be put into the residency program, or people who don't know anybody being on the street for 1 year without entering the program. It's wrong.
Well, Dr. Ngige, I'm sure that the resident doctors are listening to you. They constitute the largest segment of doctors that we have in Nigeria.
Better listen.
Yes, and you know, they also are concerned that the hospitals are, you know, being, vacated by patients and their families taking them away. Nurses are overstressed and overstretched. And at a time when we're facing a major public health crisis, they think that government should be more concerned and that you took them to the industrial court and they are all ready to go to jail if you continue to threaten them. And that Nigeria should just go and build more prisons.
I didn't take them to industrial court to jail them. I did my work as per Trade Dispute Act, Section 17 of Trade Dispute Act. They don't read it. They should go and read. A doctor should be a versatile man. As doctors, I never got tired of reading anything, whether it's economics or anything. So they should go and read the Trade Disputes Act. Section 17 says, if the Minister of Labor and Employment feels that a conciliation had failed, he should send the matter up to the IAP, Industrial Arbitration, or Industrial Court. In fact, 17 is for Industrial Court. So that is the power I exercise. Because they refuse to listen. The National Assembly's Committee on Health talked to them, they refuse. Senate Committee talked to them, they refuse. The Medical Elders Forum, I attended the meeting because of them to ask them to assist me, beg them. They begged them, they refused. And I said at that meeting that if after 48 hours, they continue to punish their patients against their Hippocratic oath, I will take them to industrial court so that industrial court will look at the matter between them and Federal Ministry of Health, not between them and myself. I'm not even party to the suit in industrial court. I'm not.
Well, Dr. Ngige would like to
say I should refer, and when I refer, somebody will own the case.
Well, on that note, Dr. Ngige, we would like to thank you very much. But we are concerned that those families who have, persons in hospitals who cannot get doctors to attend to them must be truly worried indeed, that this is the situation. But we'd like
I agree with you.
Yeah,
I agree with you.
We'd like to thank you for joining us on This Day Live.
Yes. I agree with you, Ruben.
Yes, thank you very much indeed. Thank you.